Is lack of self-care putting you at risk for burnout? Then stick around because in this episode of the Mental Health Toolbox, we're talking all about why preventative care is so important for your mental health with Dr. Ivy Loney. So let's go. Dr. Ivy Loney, DBH MSW, is the owner and founder of Elemental Integration. She holds a Doctor of Behavioral Health from Arizona State University and over 20 years of training, education, and experience in behavioral health, which has informed her work. Her goal is to create a culture of well-being by providing simple and effective tools to down-regulate your nervous system and improve your mindset. She holds that we are not the victims of our symptoms and that we can work with our bodies through the mind and support a healthier version of ourselves, no matter where we may be today on the spectrum of wellness. If you're getting value from this content, be sure to subscribe to the MHT newsletter. If you haven't done so already, you'll get notified of all new episodes of the YouTube channel, podcasts, and blog as they're released, as well as get access to all of the freebies I have waiting for you there on personal development and mental health. Okay? You can find the link to subscribe in the description below. Hello, Dr. Ivy. Thank you so much for making time to be on the Mental Health Toolbox today. I really appreciate you being willing to share your wisdom and your experience with our audience so they can thrive a little better.
Sure, absolutely. Thank you for having me.
Excellent. So I know you have a business, right?
Yes.
Called Elemental Integrations?
That is correct.
That's a very intriguing name for a business. So I'm excited to learn more. And I know you have a wealth of experience that you bring to the table in mental health, and we'll dive into that as well. Why don't you go ahead and share with our audience a little bit about who you are and what it is you do?
So my name's Ivy, and I have my doctorate in behavioral health from Arizona State University. I also have my master's in social work and really found the field a little bit later in life. I didn't go to college right out of high school. So it was truly finding that passion and wanting to help people that kind of got me on that education journey. And I have been teaching for ASU for about 2 years now for their social work program. And kind of where I'm at right now at this point is a little bit on the other side of a pretty difficult burnout recovery journey. So I was the director of 5 programs for a 2-county health system. And I had 23 nurses and social workers that I was responsible for. And it was, in many ways, it was the death of a dream having to let go of that job because it was a job that I created. So we ended up getting a grant from the state to do integrated behavioral health. And integrated behavioral health is all about prevention, right? It's not you get a referral from your doctor to go to a counselor or a therapist, right? Literally, that person's embedded in the clinic. So at the moment that you're experiencing the crisis, or suddenly you have a blood pressure problem you didn't have before, you're having trouble managing your diabetes, that type of thing, literally then the physician would do a warm handoff to one of our clinicians. And
That's
so
fantastic.
it was
hand in hand with the whole idea of public health, right? Preventative care.
Yes, preventative care, right, which was so much a passion. And so it was really this incredible opportunity that felt like the right time, just with where everything was with like the accountable care organizations with Medicare and whatnot. So it was beautiful. I was able to write my own job description. Like everything about it felt like the culmination of my career, right?
Mm-hmm.
But it was also an uphill battle from the day we started, because even though the mindset is there, right, of the need, it was really trying to turn that ship with all the systems and politics in place and everything. And so every day it was like kind of going to war, advocating for ourselves and our patients, right? And
Mm-hmm.
still not seeing the need being met, right? It was like they saw us more as crisis management rather than prevention. And so, in
Mm-hmm.
these big meetings of physicians, I would say, if you have a kid come in that has a fever, you're not going to prescribe them Tylenol and go home and hope they get better, right? You're going to seek the root cause of the infection. And that's exactly what we're trying to do here, right? Because blood pressure and diabetes and stroke, and I mean, pretty much every health condition you can kind of
Mm-hmm.
pinpoint back to the challenges that we face in modern life, right?
Mm-hmm.
And so it was really what ended up happening for me was after not sleeping for 3 days and trying to do EMDR on myself in the living room on 4th of July of 2019, I was like, Ivy, this is going to take you down if
Good
you do
insight.
not
Yeah.
make a change. Yeah. So I had to let that piece go, right? And then move on to the next phase. But it was that real grief journey because it was something that I was so hopeful for, right?
Yeah, well, you'd think for a lot of people, climbing the ladder in the health system, that would be the pinnacle point. Oh, I made it to director. I mean, I'm the boss. I'm in charge of this. But that's not the first time I've heard of that struggle with that integrative attempt, right? Having co-located mental health and physical health, oftentimes it does take a back seat, which is odd because you think physicians would really want to leverage that resource of mental health because they don't certainly have the time to deep dive into somebody's routine and lifestyle and contributing factors. That's what we're for, right? Mm-hmm. And so I can understand that must have been very not just daunting but discouraging to feel like you're spinning your wheels and not seeing the change, or at least not the vision that was mapped out, right? In actual real life application.
Absolutely. Agreed. And trying to convince people, just like you were saying, here they are so bombarded with need, barely able to keep up with their 10 to 15 minutes they get with their patient, yet they would have a clinician, master's level or above, sitting in an office maybe seeing 2 people a day. And then they're having to do the cold calls and trying to come up with people to see on their own, which is just opposite of what was trying to be created there.
And you'd think with the supply and demand issue we're having, was it 30 clinicians to every 100,000 people or something? You wouldn't have to drum up billable services.
Right, exactly.
They could be boarding up the windows.
Yes, right.
Yeah. So there's a problem there.
It really was. And then it was also like, here I am. We had a grant that was paying for the staff, and that was very successful. But of course, from that business level mindset of administration, it was much more about how is this going to be sustainable? They're looking at our numbers kind of coming down on us from a productivity standpoint. And we're saying, hey, we're trying to fill this gap here, and we're trying to do everything we could. And it was interesting because when I did my doctorate program, they did say, you've got to do all the things to establish these relationships with your providers, make the cookies, bring in the food, do all that. But in the end, after that 3-year experience, I almost think it waters things down, right? It almost makes you like a drug rep that's just there to provide the lunch and to do whatever, but then they don't really see the value or have that respect level because they don't have to work that hard to get people to buy into what they're saying, right? So it almost does water it down and make it to where they don't respect you as much or see you truly as that colleague or that collaboration.
So it sounds like a lot of it's positioning, impression management too. Absolutely. Yeah. Applicable in any department of life, right? Yes. Put a high price tag on yourself.
Yes. Absolutely.
So this experience, this pinnacle point, which in all respects, in all aspects, should have been a highlight of your career, almost burned you out.
Yes, it definitely did. Just for an example, I didn't change anything about like my diet or exercise routine. And over the course of about a year, I put on 40 pounds. So and my blood pressure was through the roof. Here I am meditating every day, doing my walks, getting out into nature, really trying to apply that self-care piece. But at the end of the day, when there isn't that alignment, and then there's that mismatch of having to try to prove yourself to that level, it just literally is physically and emotionally exhausting.
Yeah. Oh, yeah. I think, it's with positive psychology and all the talk about flow and the importance of having a sense of autonomy, and not that we have control over much in our life, but having a sense of, agency, right? Being able to affect change in our lives and not feel overwhelmed is so important. And oftentimes when we feel pigeonholed is when that stress level rises, when we feel like we're powerless and we can't change the dynamics, right? Whether that's work, family, etc. Then the cortisol rises, and then the body starts throwing signals. Yeah.
Right, exactly. Yes. And so it's interesting though, right? Because in hindsight, you see, one of my favorite quotes is life happens for you, not to you. Right?
Tony Robbins. Yeah.
Yes, that empowerment standpoint. And I love it because essentially what ended up happening for me, I live in a very small town in Arizona. So there's about 50,000 people here, and there's not a lot of job opportunities. And we're 2.5 hours from our next largest city. So truly kind of an island here, right? And so I'm thinking, well, my husband's here, my life's here, there's not much on the career horizon. What am I going to do? So I ended up deciding to take a traveling social work job, and I ended up working hospice in Seattle. And
how interesting.
It ended up being very interesting because a week later, COVID started. And so it was like, here I had, accepted this career change, desperately needing a break for myself.
It's like, okay, universe, I'm ready. Give me what you, I'm open-minded. And then the pandemic. Yeah.
Right. Exactly. So that was interesting.
Charlie Brown episode. Yeah.
It was very interesting. And what I ended up ultimately realizing was like, it doesn't matter where you are, right? Because you're still the same person no matter where you go. So because I was in the state of desperately needing a change, it felt like the change was going to give me what I needed, right? But ultimately what I ended up finding out was like, okay, it's just a different view somewhere else, right? And so, but what I love about end of life care that's so unique to any other type of mental health that I've ever done is, number one, it truly is that integrated behavioral health model. So up in Seattle, they did an incredible job of their interdisciplinary team meetings. Like, for instance, here in Arizona, the physician is the one who leads the IDT meeting. And a lot of the times it's just listening to them report out on their patient, right? There's not a lot of time to say, oh, hey, what about this? Or, that.
Very collaborative.
Yeah. Up in Seattle, the social worker led the interdisciplinary team meeting. And it just had this collaboration that was so beautiful. So it was neat to see that truly in action. But what was also neat was to see how people at end of life, they don't have that sense of completion, right? So like for us, we're all working towards something, that next level, whatever that might be, right? But more often than not, you hear people saying there's so much unfinished business, right? So many things we wish we would have done differently. And so for me, it really changed that lens of our grind and hustle mentality of the title or the bank account or whatever the things we're working toward, it shifted it just to like, this is your life. And if you don't experience and love it for what it is right here in front of you, we're taking that for granted. And what a shame it is.
Absolutely. And my first job out of high school was at a retirement home. And even though I was 18, 19 at the time, I was there like 5 years. Kitchen scrub. We would break down the dining room, scrape all the food off the trays coming down from, it was a 7-story like skilled nursing facility. But I just remember that experience and just spending time because people at that age in life and that stage, they like to talk and share stories, and don't have a lot of people coming to visit them, and it's kind of sad. But I had the privilege and honor, and I don't know that I appreciated it as much at the time, to really hear those stories and be their audience, because it gave me a respect too, and it reminds me, and I reflect on that, you know now that I'm 40, and I look back and I'm like, wow, that's life, you know moving so fast. And oftentimes we live with a foot in the past and a foot in the future, and we have a really hard time being present, right? As adults, it's so different than children who are always present, it seems, and time moves really slow. And then as adults, we have this running to-do list in our head and all of these things we want to accomplish that we think are going to fulfill us. And then you talk to somebody at the end of their life, and it's a different perspective, right?
Oh, yes, absolutely. Yes. So that was a beautiful part of the journey. And then my husband had given me a ukulele, and like, as, hey, this would be fun while I was traveling, right? And we like to sail, and so I've always talked about the ukulele because it's small and you can have it
Mm-hmm.
on the boat. So anyways, he ended up sending me with this, and it took me a while to get into it. Like, I would do some YouTube little things and
Mm-hmm.
try to play and whatnot. But what I ended up noticing was the tension that I stored in my solar plexus. Even though I've done EMDR, like, I also say I'm kind of a recovering training addict because I love training, right?
Right, right.
Always a new thing, always a new
Mm-hmm.
tool. So I also have had a lot of anxiety in my life. I ended up in a rollover accident um, December before my graduation year in high
Mm-hmm.
school, and I broke my back and
Oh, wow.
suffered with a lot of pain since then. So
Mm-hmm.
I've managed chronic pain and my own anxiety journey, right? Because for
Mm-hmm.
2 years since I was the passenger, I would not drive in a vehicle with someone else. I would always drive my own vehicle, right? Because I had
Mm-hmm.
that trauma response.
Makes
Of
sense.
course, at the
Yeah.
time, I didn't know what that was, more so than just maybe feeling like I needed to be in control, right?
Mhm, mhm.
But what was interesting, so I always had this low lying solar plexus tension because I'm also a perfectionist in many ways, right? Like, straight A student, held myself to really high standards and things. So I had this real low level tension here all the time. Well, what was interesting was when I would play the ukulele, that resonance from the music vibration would relax that nerve bundle, right?
Mm,
And so I started thinking, this is really interesting. There has to be more to this. So I started to really delve into sound therapy.
mm,
And that became a really amazing journey, like the wealth of research that's out there. So now in my current practice, elemental integration, which I
mhm,
call EI, because elemental integration stands for basic wholeness, right?
mhm,
And we are whole. Like, our bodies it's just this incredible machine of self-regulation, right?
mhm,
So when you think about it, we're stressed, we naturally want to, oh, I'm stressed, right? And that releases neurochemicals. It helps to relax the vagus nerve when you sigh. Like, there's so much to our self regulation capacity. yet that's been conditioned out of us, right? So like now I go around and do different talks and whatnot, and I'll have people sigh or hum, and you see how people are like, they're really timid to make the noises, and
Right.
it's just funny because it's like, yes, we do get that, conditioned out of us, like be quiet. I can even
Mhm.
remember sneezing in first grade, and the teacher sent me to the principal because she thought I was being obnoxious.
Wow.
And now I
Seriously.
still sneeze really quietly and try to hold it in,
Well,
which
now it's
isn't
taboo, right? You can't sneeze in public.
isn't that the truth? So I ended up creating elemental integration actually April of 2020. So it
Mhm.
stands for basic wholeness. And it's that idea that you're already healed. In many ways, you have the capacity for it within yourself. It's just really tapping into and trusting that piece of yourself and building up that strength over time. So it's just neat to me, all of the different modalities that are available to us that we often don't recognize. And so I do both. I have a sound therapy bed, so it plays tones on the body, and it's amazing just people's response to it. It truly taps into deep relaxation. For instance, I had the cutest little 9-year-old who's autistic, and
Mhm.
just bouncing off the walls, all this energy, right? And so I said, here, sit down on this pillow, put the headphones on him with the binaural integration piece, right?
Mhm.
And it was honestly like you just watched this relaxation come
Mhm.
over him. And he's just literally like leaning into the pillow, so calm face. It actually ended up making his aunt tear up because she was
Mhm.
like, I have never seen this kid have a moment of peace. Like he's a happy
Mhm.
boy, but it's just a
A lot
constant
of tension. Right.
yes.
Yeah.
And
Makes
then
sense.
what
I mean, you hear about a lot of the power of tone. That's the whole idea with the singing bowls, right?
yes.
When I would run groups on mindfulness, we use those um, semi frequently that, to start off the mindfulness and meditations and stuff. And I know there's something to it, but I have not personally done a very great job at educating myself into that sector. So
Sure.
it's
Well,
nice
and
to know
most
something to.
don't.
Hmm.
Yeah.
Right. It's
Most
not. It wasn't really in our training in
no.
graduate school.
Agree.
But
And
yeah.
I would even think of certain things like I remember poo-pooing things that
Like, oh,
seemed
that's woo woo.
really
That's me. Right. Yeah.
exactly. Now on the other side of it, I'm like, I will never again discredit anything that brings someone peace. Like when you look at placebo and all of the things that come into play, somebody's belief in that something is theirs. And if
Hmm.
that works for them, fabulous.
Right.
Yeah,
Absolutely. Yeah. Different folks, different strokes. For me, power naps, big, 10 minutes. It doesn't take much, but it's not so much the resting as much as it is creating space to decompress. You know,
absolutely.
I could just be sitting in the yard and our pandemic project was to create a butterfly garden, save the butterflies, and I could talk for hours about that. But just sitting in the patio, with my dogs who follow me everywhere, and you know, just watching the butterflies in the garden goes a long way. It doesn't have to be much. It could just be 5 minutes in the morning, right?
Oh,
It
absolutely.
primes the mind for the day, centers me.
Great.
Yeah,
Yeah.
yeah.
I love that 10-minute rule or even a 5-minute rule. So
Mm-hmm.
you can't do it for an hour, but can you do it for 5 minutes or 10 minutes?
Right, right. I find most of the time that's usually all I need is just 10 minutes of not allowing myself to be pulled away, or to do work in my head, right? Think about all the things that have to be done, just creating space.
Yeah,
Yeah.
exactly. And the more you do that, the more space you find. But it's hard where the cards are stacked against us, I think, really, and just the busyness of the society and all of the things going on. it definitely makes it harder and harder to carve out that time for yourself.
Yeah. Then going back to what you had mentioned just a bit ago about giving ourselves permission to self-soothe, right? Even to express, to exhale a little bit, right? Or yawn in public, it's oftentimes we catch ourselves and we stop ourselves from self-soothing.
Yeah.
Right. Because, I don't have time for that. Or someone's going to think something of me if they see me, they're going to think I'm bored or I'm not paying attention or, I'm complaining or all that self-talk, right? That
Oh,
prevents
yeah.
us from protecting ourselves. Yeah.
Yes. And how often when you sigh, someone around you goes, "What's the matter?"
Mm-hmm.
As if it's a bad thing.
Mm-hmm. Right. The
Yes.
connotation. Yeah.
Yes.
So this is fantastic work you're doing. So you have a sound bed. Basically, it's a safe space for people to come into, right?
Yes.
And then they have a soothing session, or how does that work?
So it kind of depends. I do the sound bed only after they've had a consultation because I think it's really important to also understand the mindfulness piece, the cognitive behavioral therapy piece. So I like to do a little education in the beginning, pull in that empowerment model, the solution
Mm-hmm.
focus.
Mm-hmm.
And then they end the session by spending 20 to 30 minutes on the sound table in the deep relaxation. And I often tell people, don't get so hung up on the table. Like the table is a tool that really gives you a glimpse of what's possible for yourself. So I have a lot of clients who will say, like, do you think you could get addicted to this table? Right. And I'm like, I don't know, not in that sense. I mean, of course you miss it, but like even for me, I have the tool at my disposal. I don't use it every day, but I don't need to. And in a way, what ends up happening over time is when you develop that deep connection with yourself. And so I do a lot of body wisdom talk. And
Mm-hmm.
instead of being annoyed that you have that headache or annoyed that your irritable bowel syndrome's flared up or whatever the case
Mm-hmm.
may be, take that as your body's communication, right? Maybe you need to slow down. Maybe you need to drink more water. Maybe you need to be, tweaking your diet a little bit to be more supportive, that type of thing. So, really leaning into the body wisdom. But what's cool is when you open yourself up to that capacity for connection, especially to the vibration in our lives, right? So
Mm-hmm.
there's this great Jason Mraz song that's called Take the Music.
Mm-hmm.
And in it, he says, even the smallest bird hums, right?
Mm-hmm.
And so when you really delve into this work, what ends up happening is you experience the world in vibration. So, like for me, when I hear a hummingbird buzz by, or a bee, or even a car, or sometimes just the resonance of my own voice or your voice back at me, I feel it more in the vibration. So it's like it enlivens that sense within you too, which is beautiful because then you're more aware of the world around you and through nature.
Absolutely. That makes perfect sense. We talk a lot about mindfulness as observing, but not necessarily as much as feeling, as being physically present in our environment, right? And
Yes.
feeling, like you said, the vibrations around us and being intentional about it, right? It's one of
Oh,
the
and
reasons I love hummingbirds. When I see the hummingbirds come to my porch, I'm always fascinated. Yeah, they just give off such a nice vibration with their wings.
oh, definitely. I actually have two feeders out front too. Yes.
Yeah.
But I think you hit on something that's so important is that intention, right? Because if you have that intentionality in your life, and I do that with watering, and I use this as an example to clients all the time, is like if I go out there rushing to water because I've got to get on to the next activity, right? I'm
Mm-hmm.
in that hurried mindset, which is keeping my nervous system activated. But if
Mm-hmm.
I literally set the intention of making that experience of watering about, noticing and connecting with the plants that are out there, right?
Mm-hmm.
Like oh, this one's looking a little sickly, or this one's looking exceptionally green, or whatever. When you do that, it completely shifts your entire experience of watering from, oh, I got to get this
Right.
over.
Another to do, right?
Yes. To the joy.
Absolutely. And again, going back to the butterfly garden, that's definitely something that's helped solidify that with me, is because, look, when you get in the habit of looking for caterpillars and caterpillar eggs, which are like microscopic, and predators like praying mantis and stuff on the milkweed and stuff, it forces you to slow down. And so watering the garden is one of my favorite things to do. When I actually make it a point, if my wife says, "Oh, can you water the plants?" I'm like, "Yes, please."
Oh,
Gives me an
nice.
excuse to slow down, because I know I'm going to go out there for like 20 minutes watering all the plants, and it's very therapeutic because I know it's going to slow me down, because I know I'm going to observe, and it's my happy place is being outside in the garden. So
I love that. And just like you spoke of, it's that ecosystem, right? So
mm-hmm.
even just how the plant becomes a place of survival for these young eggs that are ready to, I mean, when you look at it from that level too, I think it gives you a whole new appreciation for life and living.
Absolutely. Yeah, I think butterfly gardening, I now am convinced, is one of the best things you can do for your mental health.
I
Yeah.
bet. It
Yeah,
sounds
yeah. And you're giving
lovely.
back to the environment. So
Right.
make a pollinator garden, right?
Nice.
Very good.
Absolutely.
Excellent. So you have this fantastic business you've built out of your own experience with burnout and trauma, and you've learned what's soothing for anxiety and tension. And how does that translate into the work you see yourself doing moving forward? How does it expand into the work you're doing now?
So I'm pretty much, it's interesting. And I don't know if you experience this too, because I think as social workers, especially, we're taught to be all things to all people,
Mm-hmm.
right?
Absolutely.
And so it's funny because working with social work students, and then I also have many, many social work
Right.
friends, it's always us that struggles to create that niche, right? Because we're like,
Mm-hmm.
but what about this population?
Right.
But what?
Exactly. Don't leave anybody out. Yeah.
Yes, exactly. So it's funny because I've always been a person who likes to keep all my doors open, right? But I also feel like this is definitely my niche. So I'm getting ready. We're actually working on a bit of a construction project here to create more of a personal retreat space. So I'll be offering eventually, probably late fall, some personal retreats. We have a cute little cabin. We're on an acre. In the woods and
Wow.
actually northern Arizona. So we're very blessed
Great.
in that way.
Mm-hmm.
And then I have my practice, which I'm going to continue doing and just kind of see how it evolves. Like, partially it's interesting because I feel busier now than I even was as a director, right? Doing all the things, but just
Mm-hmm.
the joy that it brings is so different in that aspect. So definitely just continuing to build this out. Our goal ultimately is to live on a sailboat. My husband's actually been in the fire service for about 20 years, and so
Oh, thank
our
you for your
goals,
service. Yeah.
yeah, he loves his work. He's one that was very fortunate to find something that suits him really well.
That's so important. Yeah.
So our goal is eventually to do some personal retreats on the sailboat as well, and just do a mix. I actually almost ended up doing my doctorate in experimental psychology with
Hmm.
a professor out of southern Mississippi, and we did a study abroad with a dolphin pod in Honduras. And so I've tried to meld my
Mm-hmm.
love for the ocean with being
Nice.
landlocked in Arizona.
Mm-hmm. Mm-hmm. It's always good to keep an open mind. Yeah.
Exactly.
But equally important to have a why.
Right.
I remind myself of this, and I try and remind all of my clients of this, on the podcast and the channel here, is that it's so important to have a why, not because we want to add pressure to ourselves, but to remember why we do the hard things, right?
Yeah.
Why we discipline ourselves is because there's something meaningful there behind our values that we're working toward. Not that we can ever control the outcomes, we only have control over our actions, but it's important to remember, if a certain quality of life is important to us, how do we start taking steps to the direction to create more space and freedom, like you said, because at the end of our life, we're gonna look back and it's gonna be important that we have that solitude of being able to say yes. I had my autonomy. I had a sense of autonomy in my life.
Yes.
You know.
Right. Oh, absolutely. And it's interesting you say that. I just had a patient. They were an older couple in their early 80s. And I showed up at the house and she had passed about 10 minutes before I had gotten there. But
Mm.
what was so beautiful was his sense of calm, right? And so when I said, I'm so sorry, he said, there is nothing to be sorry for. Like, we literally lived and had a beautiful life. And I just love it when you get those
Mm-hmm.
glimpses of people who were able to create that for themselves and have that experience, right?
Absolutely. Absolutely.
Yes.
That's the
It's
dream.
beautiful.
Yeah.
Yeah. And
Excellent.
leaning into that gratitude is a choice, right?
Mm-hmm. It is, it's not so much about accomplishing tasks that makes us happy. It's ability to be present and be be intentional, but our attention and our intention in the same place, right?
Absolutely.
Absolutely.
Agreed.
Yeah.
Yes.
So I know you have a wealth of information. We're just at the tip of the iceberg here. Um, where can people learn more about you and the work you're doing?
Sure. So I'm kind of limited on social media, pretty much to Instagram, and still playing a little bit with exploring other modalities. But Instagram, and then my website is elementalintegration.com. And I do also work with people who aren't local and send them tools to be able to incorporate much of what I do in the office in their home wherever they are. And so I definitely love to work with people from all over and just see. Also, that's the interesting part too, is seeing how where people are from and what they're surrounded by, and utilizing that to create the connection with nature and coming back with themselves. Because while I'm blessed to live in a beautifully abundant nature area, not everybody is.
Yeah, it's such a rarity, it seems now. They call it nature bathing. We have to come up with a name to go for a walk in the woods.
Right.
Go for a hike. Go nature bathing.
Right, exactly. So the goal
That's
is
how
really to,
deprived and starved we are of
right. I know.
nature.
I agree. Yes. And
That's why I think I like the garden. It gives me a glimpse, of something different than, concrete jungle and stuff. So
right,
yeah.
exactly. Even in a small backyard or on a
Right.
patio, you can still create that
That's right.
space.
That's right. It's the great thing about community gardens. But that's a whole other conversation. Yeah. So if I'm not mistaken, when I was perusing your website, which is very nice, by the way,
Thank you.
I could swear I saw something about free ebooks.
Yes. So I do have an ebook. It's for healthy nervous system regulation. So it gives you some tips and tools. I also do that on Instagram as well, posting little things that you can connect with. And it's funny because I always use the pun, what resonates, right? Because the resonance of the sound and everything,
I love
but
that.
really tapping into that capacity for self regulation.
Excellent. Excellent. So many nuggets of wisdom. Is there any other quick tips you would like to share with our audience before we wrap it up?
Sure. So, two of my favorite is a breath work technique called the 3-5 breath. And a lot of people struggle with longer exhales, and that also kind of cues you into where your nervous system is at, right? Like, if as you're exhaling and it feels like that sense of panic of I can't get breath back in,
Mm-hmm.
that shows you your nervous system is on high alert, right? So trying to break it down into something that's a little bit easier, like there's the 4-7-8 breath, but that does create a lot of anxiety for people with anxiety. So
Mm-hmm.
I try to focus on the 3-5 breath, which is a 3-second inhale and a 5-second exhale. And anytime you exhale longer than you inhale, you're sending signals to your system that everything's okay. And it's really cool when you start to look into the science of the heart and how the diaphragm on the exhale creates more space to allow the heart to relax. So there's a lot of really cool physiological principles to the why there as well. But if you do a 3-second inhale, a 5-second exhale, not only are you naturally calming the nervous system, but you're also giving what I call a toy or a tool to the monkey mind with the counting, right? Giving yourself a
Mm-hmm.
little bit of
Mm-hmm.
space there. And then for an added bonus, I'll either hum or sigh the exhale. And when I do the humming or the sighing, I always try to play around a little bit with trying to feel it in different spaces, like my solar plexus or more in my throat, even sometimes trying to bring it up more into the brain,
Mm-hmm.
creating more blood flow and different things as you direct your attention in different areas. So it literally creates that massage. What's also interesting too is humming. If you bring it up into your nasal cavity, it actually has antiviral properties,
Yeah,
the
no kidding.
resonance that
That's
happens
fantastic.
in the sinuses.
Yeah, and breathing techniques are probably one of the most taken for granted coping skills that I'm aware of.
Oh,
Absolutely.
yes.
And you just supercharged them with those tips. So thank you. I appreciate that.
And it's free, and you
And it's
carry it
free.
with
You take it
you
with you anywhere.
everywhere.
Exactly. Exactly. It just takes a little permission from ourselves to pause and do that. Yeah.
Exactly.
Excellent. Well, thank you so very much. I really appreciate you being on today and sharing your words of wisdom with our audience. And I love the work you're doing. Would it be okay if I had you back on down the road, see how things are coming along?
Sure. I would love that. Absolutely.
Super. Well, thank you so much, Dr. Ivy. I appreciate your time and I wish you a blessed week.
Thank you. You
All
as
right.
well.
Thank you
Thank
so
you.
much. Bye bye. Well, there you have it. Another tool to help you thrive. Hey, if you're getting value from this content, be sure to subscribe to this channel if you haven't done so already. And as always, please do share, like, and subscribe to help raise mental health awareness. All right, so until next time, go make good things happen. Bye bye now.